Hello and welcome back to Healing Through Our Heritage, our Black History Month talk with um, Black people who work in various, um, in a wide variety of the medical field. And today we're talking to Jelani Kemp, who is an EMT, paramedic in training, EMS trainer, and the most important role he could have is my firstborn. Jelani, please tell us about the work that you do and what brought you to that work.
Yes, my name's Jelani. All the things that my mom here, Nneka, has said so far. I've been working in EMS now for 6 years, over 6 years. Um, so I guess we can start with how it started. When I went to first year of college, first semester of college, a friend of mine suggested that I take the EMT course. It seemed like something that, someone on the pre-med track could go and do. Um, would be a great opportunity to work that one shift a week and make money on the side with the details and all the other options that were there. And it's something that you could do part-time while still in school. Now, for a few years, that's what I was doing. Where it was just, one Saturday shift. It was 9:30 to 5:30. Transfer work for an organization that no longer exists. They got bought out and bought out, but um, eventually, there was opportunity to start training people, becoming a field training officer, and I jumped on that opportunity. I said that there is obviously a need for training. There's a need for people to go into this role, and I immediately got shot down for that opportunity. They said I have the experience yet, and I was only an EMT for about a year and a half then. So they did give me an opportunity to then go into the training and education department at that organization at that time. And I said, yes, I'll do it. I'll be assisting in different classes they were running, being a TA, learning how to go through the different uh, things needed to teach people how to be an EMT, teach people how to work in the field. And I'd say that that was the kind of doorway opening into all the other training things, learning that I like teaching. I like um, being there for the aha moment when you're talking to students and they understand that they finally understand what you're trying to do, what you're trying to teach, what you're trying to what path you're trying to bring them down. Um, of course, I started working EMS back in 2019. Yeah, 2019, and a year later, um, then we had the pandemic hit. So that kind of changed how things were going on. That changed schooling to be remote. That changed. We all know what happened during that period. So went from being on the road as an EMT once a week doing orientations, bringing in new hires to, well, everything's shut down now. We need you to go do COVID testing. We need you to go do this, that, and the other. And I'd say that was the biggest eye-opening moment as someone who's working in healthcare when you see how people who are you're going into tests because we were the organization I was at then was one of the largest testing organizations in the state in the Commonwealth of Massachusetts. Um, how we'd be going in to test people, and at the same time you'd pull up. I always refer to this um, one testing site we went to at this one nursing home where we brought I wouldn't want to say it was 4 or 5 ambulances filled with all the testing equipment. We were going to test their staff, test the patients, anyone in and out of that facility. And the 5 of us roll up in a convoy, and coming behind us are 2 hearses. And it's like, well, this is welcome to healthcare. Um, so I'd say that kind of changed that pathway of wanting to go down the pre-med track because it's like, well, all these people who, want to go down the path of becoming doctors and this, that, and the other. And it's like, well, is that where there is a huge need now? Is that helping us during these types of situations? And, that's coming back into play nowadays when we have the what is it called now, the quademic of people getting the flu, RSV, neurovirus, and COVID, where it's like, well, what are we having issues with here? And also with the huge um, lack of access to healthcare that's happening, the lack of PCPs, the lack of people having the ability to go to their doctor. I mean, we all go to our doctor's appointments and it's like I have a list of issues that I need to deal with. Or you have this problem and it's like, well, here's your 10 minutes of me looking at the computer while um, you spew out your information. We'll talk about it in a year. There's only one problem I can fix, and that's just the system we're in right now. Um, Luckily, I've found a doctor that I'm able to talk to, but I know that's a thing that a lot of people have issues with. And we're starting to see that we have seen it for a while in the healthcare sphere after COVID. We lost so many professionals, not just from them dying, but also from the burnout of working during that time where it's like you're going nonstop. Was working, uh, I'd say 16, 18-hour days of just COVID testing in different places in the state, going different places, and it gets to you. We lost a lot of people during that time. Um, but then to see how different populations are being um, you know affected also was showing, and it's showing the big health disparities that exist in this time too. So um back when I started, I was more in the transfer side of things where I was taking people from um the hospital to rehab, the hospital to their home, to the nursing homes to dialysis. So it's a lot more tame, but moving into as of late, I've been working more in the 911 aspects of things. So going to the emergencies, dealing with people in their times of need. And what I'm seeing is that now things that have all the COVID, I'm not going to the doctor, I'm not dealing with this, I'm not, it's coming back, and it's coming back with a full vengeance, especially in populations, which I'll get to in a second once I get to this, but um, that there is a huge issue with public health in I'd say this country and many other countries that are seeing this with the post COVID, where it's like we lost so many providers, we lost so many um, hospitals. There's a lot of hospitals closing down. That now we're in a time of need, and of course, whenever there is a time of need, we know that the populations that are poor, populations of color, um, are going to be the ones affected. So, who's calling 911 more? Well, if you need a PCP, how long are you waiting to go to your doctor? Um, does your insurance cover going to your doctor 2 times a year, or does it cover you? Um, Going to urgent care. Well, where's your only option for healthcare now? It's going to be the ambulance. It's going to be the emergency room. So that on that side of things of the transport side, I'm seeing that the post-COVID lack of providers is really affecting that side of things. And that kind of led me into the mindset of, well, there's more of a need to public health. There's more of a need to, yes, there's a need to train people to, do public health initiatives such as hands-only CPR. I recommend that everyone gets hands-only CPR. Stop the bleed courses, learn how to stop bleeding. If someone's bleeding out, everyone should know how to apply pressure to a wound or apply a tourniquet to a person or pack a wound if someone's bleeding. Um, but there's also a need to help train to get more people into the professions. There's a need for more EMTs. There's a need for more paramedics. Um, Outside of that, what I've also noticed is that many people who have many friends of mine and that I've gained over the years, we're all in college, we're all doing our thing going down, and I noticed that they go through, they finish, they get their degree, and then it's like, well, now what? Because there's also just no jobs out there for people to get because of all the lack of access and things like that post COVID. So there's a lot of people who are now going to get their paramedic certification. There's been a huge push where people who I'm noticing a lot more people that I started with that were part-time or came in that were part-time working with me. Even my former partner that I was on the truck with for years is getting their paramedic because it's there's a need there. That's one of the jobs that, at least I don't see anytime soon AI taking over. I mean, if anything's possible with AI nowadays, but um, so that kind of pushes me to want to that pushed me to want to get my paramedic certification, the license to be a paramedic. Um, but also then on the other side of things, being able to then, get the experience to teach people how to become paramedics one day or teach people how to do the classes that are needed. Of course, I teach people how to become EMTs now. I've taught countless of a number of EMT classes. Um, and I'm seeing that there is a need to get more people into profession. I teach for my organization is an EMS organization, and I teach for a college. Um, and what I'm noticing is that when I teach students at the colleges, we have classes, we could be running 3 classes at the same time. We could have upwards of 90 students. Um, Minus the people who don't make it through, minus the people that, are getting it for other things. Um, Out of all the people who are taking these classes, we're only getting 1 or 2 people that are actually going to go work on the ambulance out of 90. Um, Maybe 5 people max. So there is a need when the system's overwhelmed. Um, the municipality that I work for, well, the organization, we cover different municipalities than the one I work for. Um, I've noticed that we've been starting to get called to other places too, and that it's because ambulances are being run. I mean, it's mutual aid is what it's called when you get called to another community because they don't have the resources to handle what's going on. And seeing the patients that I'm getting in those municipalities, it's going to be the minorities. It's going to be people of color. It's going to be poorer people. It's going to be, um, you know, all the people that you would expect to have the disparities in healthcare to not be able to just call their doctor and figure out what's going on. Well, it's overwhelming just the system's being pushed to its limit and trying to help or in goal see how I can um, be part of the change to make things better. Well, that's the end goal of all these things. Because as someone who's started pre-COVID and have been worked through COVID and now working post-COVID, I'm noticing that there is just a huge um, loss in the system. I mean, when I started in 2019, my orientation class at my company had, I want to say, 8, 9 people in it. I'm the only one left from that. And I talked to other people that had started after me, and it's like, oh, this is the only person left. This is the only person left. Um, which also brings into another problem with the system as a whole is because you're losing your experienced providers. So now we have inexperienced providers being put out there in situations where the healthcare system is falling apart, and people are calling because they're having complex concerns, and it's like, how do we handle that? Right? Um, I never admit that I know everything that's going on. I've taken different trainings to try to improve my ability to handle different cases that go on, different conditions that people have, different um, situations that may arise. But there's a bunch of new things being thrown out every day. There's different concerns, different outbreaks. We have the opiate epidemic that's going on, where they're now synthetic drugs being added to the um, It started out as heroin, and now we have fentanyl and carfentanil, and there's other drugs out there that now Narcan, the big drug that everyone was pushing for, Narcan, Narcan, Narcan. I'm not saying that Narcan is a bad drug to have. I say that everyone should have it to be able to use it if they do counter someone who's having an opiate overdose. But um, now we're having drugs being added that are not responsive to the Narcan because they're not opiates. They're synthetic drugs being added. And I'm seeing that there is that there's a lot of concerns rising, and I just, one or two things going to happen. Either the healthcare system as a whole is going to collapse eventually, or we're going to have to start pushing and start legislating and start seeing ways that we can improve the system. I know that there was a federal bill that was pushed. It didn't end up going anywhere because it was a previous Congress that was about treating in place, which is pushing towards that mobile integrated healthcare aspect of EMS, which is arising, which is the idea is that instead of having the ambulance come out to you and take you to the emergency rooms, which are crowded. I mean, if you go to the emergency room nowadays, how long are you waiting? Hours on end before you even see the doctor. Instead of doing that, why can't we treat people at their homes for their chronic conditions? Why can't we have a paramedic or an EMT and a paramedic go out and take your blood pressure, check your vitals, check your heart, check to, run blood work at your house, take it in or telehealth into the physicians, and you don't have to leave your health. Because especially in our high risk populations, the elderly, um, that hospital visit, usually they end up leaving with something that they didn't come there with. There's a lot of different, as I said, there's four diseases going around right now. So go in there, you have a, 1 in 5 chance of leaving without anything because there's four other things that you could possibly leave with. And it's just hurting the system as a whole. Um, so it's another concern that is out there because we have, emerging diseases, we have a lack of public access, we have hospitals that are closing, we have a lack of primary care providers, so that leads in with the emergency room. We have too many people that are in need of medical care that can't get it because of lack of funding. There's not many jobs out there, so people aren't working. If they are working, their jobs don't have that great health care that they can go to the doctor when need be. They only are given their one appointment and then they can't afford their prescriptions. Um, or they're on Medicare and they're just not getting enough funding to handle the complex treatments they have. I mean, we all know that the elderly populations are going to have more conditions, and there's something that we talk about called polypharmacy, where you have to take this drug to counterbalance this drug because of this drug and this prescription and this one, and then if you have to take 8 medications a day, can you afford that? Right? Can you afford to have um, all those medications and then be able to eat even 2 meals a day, 1 meal a day? Um, and it's a huge problem. It's a huge flaw in the system as a whole. And it's also, you're looking at major healthcare systems, and there's a lot of layoffs happening, like the Mass General Brigham system. They're laying off tons of employees, and they say that it's just to, cut waste at the top or whatever it may be. But at the end of the day, what are those people doing? Who are they supporting? If we get rid of those people, does that leave one person in the role that's now going to have to cover all the other people? And it just feeds into the collapse of the system as a whole. Um, so seeing it in the pre-hospital side, and it kind of makes you not want to go into the hospital side. I mean, the other aspect of it is it's just um, it's a big difference between working on an ambulance and working in an emergency room or working in a hospital because hospitals are controlled. Um, the world is not. you never know what you're going to in an ambulance, and that's part of it. Part of the adrenaline rush of working on an ambulance. That is why I still work on a truck once a week on top of all the other training, because I like treating people, but I also like going to see what happens, and kind of figuring out as we go how we can treat a patient depending on the complex needs they have. Um, and a lot of patients have a lot of complex needs. There's a lot of places that we go to repeatedly, nursing homes, which that's a huge problem in itself. A lot of the nursing homes where we see that the providers do not care about the residents. Where we can go up there to the desk and ask about, all right, I'm here to pick up, Jane Doe, and they're like, oh, I don't know Jane Doe's history, and it's like, you're the nurse. Well, I just got here, or I'm not on this floor, and there's a huge problem with the system, and you see it all the time. Nursing home, closes, and they reopen a month later with a new name, and it says under a new management, and it's like, well, it's the same exact thing. It's the same exact employees, um, and that lack of care is affecting people. Where it's like, well, this person has had pneumonia for 4 days now. Now you're calling when they're on death's door. What can we do as a system? So there's a lot of aspects that need to change, but what I've noticed, the biggest thing is public health, health disparities between those of color, those who are lower income, and the gap is getting bigger. The between those who the wealthy and the 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 wealth gap, where we're seeing that those who are all the way up there can get everything and all the care and see their PCP, and then we have down here where it's like, um fixed income, living paycheck to paycheck, where this is all they can do. I work in a very affluent community, and I have for a while now, but the majority of people who are calling 911 are not the people that are making all the money. It's people who are able to live there because of, they have their family has built up to be able to afford the house. But then outside of that, they're on Medicare. They're living on a fixed income. They're not working anymore, or they have other things going on, and this is the only way for them to be cared for. Um, so I do think that and this is a topic that has been discussed, amongst many of the people I work with, many friends of mine and that work in EMS, where it's like, well, what do we do? What is the next steps forward for the EMS system as a whole? And, it used to be, I'm having a medical emergency. I'm now going to call 911, and I'll be able to go to the emergency room and have it cared for. Well, what is a medical emergency anymore? That's the biggest question. Um, I got called for a person who was having cramps after eating chili. And it's like, well, I get it. It happens. It's uncomfortable, but does this need an ambulance? Or um, when people call delayed, and it's like, well, I've been feeling this for a while. Well, now what? Well, now what can we do? I know, last time I worked, the other truck that works in the town I work in, got called to a person who fell 4 days ago, and they still have some pain from it. And it's like, if you fell 4 days ago and you're having pain from it, is that a trip to the emergency room, or is that a trip to your PCP? Well, does the person have a PCP? How long do they have to wait to get to see their PCP? Is it going to be a month, 2 months, a year? Some PCPs have a year waiting time before you can get in to see them. And the system as a whole falling apart, it's really affecting, it's affecting people, it's affecting providers. There's a burnout. People don't want to come into the field. We're losing more providers than are coming in. We're lucky here to have in Massachusetts, all the systems still in place. But if you go to rural United States, if you go to places that are not cities, how long are you waiting for an ambulance? It's sad that that is how things are. Um, but how do we get to the point that we can improve that? I don't have all the answers. But I know there is a need for one, to get more people into the field, but two, to find more initiatives that we can work for, more public health initiatives, more um, systems of care that can treat people in their houses, than to keep just overburdening the systems, burning out providers, losing everyone, and then what? When the system collapses, what are we going to do? When things go horribly wrong, how can we fix it? So those discussions needed to start have it happening 5 years ago. But the more we kick the can down the road, the worse things are going to get for the system as a whole. And seeing that and knowing that I work with a great group of people that want to help um, start that change of improving the systems as a whole, I'm hoping that we will, as a collective, be able to start pushing to make the system better. Of course, funding's a huge issue nowadays. Many fire departments don't have funding. Police departments aren't getting funding anymore, especially with the spending freezes that are happening. So that's only going to set back the system as a whole. Many fire departments with they got federal grants for new equipment, new gear, new employees. They pay for it and the government reimburses them, and they got told they're not being reimbursed. Well, now what? Now how do we pay for these things? We don't have any money. The system's going to fall apart. Um, and you don't want to be in a place where if you call 911, it's not a question of if an ambulance will show up instead of when will the ambulance show up. Because with the path we're going down, it's starting to get to that point where the system is being spread thin. Used to be if a town got busy at organization I work at, there would be another ambulance coming in and another ambulance coming in. But now it's like, well, we have to call another town. And we're seeing that in other systems where we're getting called to their system because they don't have people, the support network there. Um, and I think that if we don't address the disparities soon, then things will go horribly wrong. So I think that the key takeaway of what I've learned in my time or what I've gathered or why I stay in this instead of going and working in a working as a doctor is that yes, I can go and be part of the system as a whole, which is just going to collapse eventually, or I could be here and seeing that working on the public health side of things where it's like there is a need for a lot of different things where it's not we have a great healthcare like system as a whole where it's like you can go to a doctor, you can go to a hospital that has groundbreaking technology, but then if you look at the other side of it where it's like actual paying for it, actually getting that care, actually having access, it's horrible. It's horrible. Um, where people are worrying about getting their prescriptions over eating that week, or people are cutting up their medications because they are thinking that maybe if I take half my pill today, I'll be able to last the rest of the month because you get a month supply, 30 pills, that gives you 2 months. And it's a huge problem. And we know who that's affecting, where it's the those who are lower income, those and that pushes into the communities of color. Um, those who don't have access, the healthcare centers closing, not having doctors, um, and many hospitals closing, um, and the wealth gap in the hospital system as a whole, where we see that the Mass General Brigham system is laying off all these people, but then the CEO is getting a pay increase, or the Stewart CEO who was in Paris, France, while his hospital systems were being closed and everyone was being laid off, and that closed down the Carney Hospital in um, Neshoba Valley in Massachusetts, which it's like okay, it's two hospitals, but then we also lost Norwood Hospital a while ago. for period, there was 4 hospitals closed. The Kearney, the Norwood, Neshoba Valley, and Brockton Hospital, which is that's a lot of people being pushed to other hospitals. Um, so unless there is a change, unless there is a public outreach, um, a push for public health, um, turning EMS from being, and I'm seeing it, every private organization is pushing for that mobile integrated healthcare now, where we need to push from being, let's transport everybody to the hospital to what's going on. Do they need a hospital or do they need to stay at home where we can then care for them? Um, is there a need for someone who has the flu to go to the hospital if they just have a runny nose and a cough? Most cases, no. I mean, everyone gets the flu at some point and they're miserable, but it's not like I'm so miserable that this is that. I'll just go and, you eat your soup and drink your orange juice and all the other things, and you eventually get better. Well, as the system is right now, if that person calls 911, I need to convince them to go to the hospital. What is that doing? It's just exposing more people to it's exposing me, it's exposing my partner, it's exposing the doctor, the nurses, or anyone else in that emergency room to that patient that has the flu. So why can't we tell this person, you don't need to go to the hospital right now. Instead, let's monitor you. We'll send someone out in a couple of days or tomorrow, or whenever, and they'll be able to come in, they'll check you, take your vital signs, do everything you would have at the hospital. The person needs fluids. With the MIH program, they can start an IV and give you fluids in your own house instead of overburdening the system as a whole. So pushing for that is important. So I know it was starting out by talking about why I got into it, but the key is, I started it as just I want to do this part time while I'm pre-med in college, but quickly learned that working through COVID, that more of a passion in the public health side of things than working in the hospital, where it's like, yes, the system's broken, but I need to do this, that, and the other instead of being outside of it and seeing that this is what's happening, still being connected to that side and seeing the problems and trying to work with other people to fix it and hopefully um, get us into a better place at some point so that the system eventually doesn't collapse with the way that things are going.
Wow. That's all I can say is wow. Um, this has been enlightening. My question is, now, as your mom, I realized very early on, especially during the pandemic, with some of the stories that you came home and shared, that there's no way a parent can prepare you for the things that you witnessed. What is your self care like? Because I know a couple of weeks ago you text me that you reported to um, a person who had been involved in a drive-by shooting. You've told me about stories where people have attempted to commit suicide. You've told me stories of showing up and the person is deceased. How do you decompress from all of that? You even shared with me having a moment in a nursing home between calls because you didn't have an immediate call to go to, just sitting with someone who you knew, wasn't going to live long. How does that affect your mental health? How does someone like me, as your mom or anyone who's in this field, their support team, how do you decompress? What do you do to keep doing this work? Because a lot of the people that you started off with are no longer here, either by quitting and moving on and doing something else, or sadly they've taken their own lives. How do you not become those people? Because I just keep seeing you go up and up and up and moving into um another realm, and you already said you only transport once a week. And I just want people to understand that once a week is not a traditional 9 to 5 shift, it is a 24-hour shift. So in that 24-hour period, you're showing up to multiple calls, having to sleep in your room at the wherever your hub is, um, and then being awakened and having to jump into action. How do you hold yourself? And I'll stop talking so you can answer.
So one thing I always say, and as someone who runs the orientations at my organization, I always tell people that go into the call knowing that you did not know this person before, and you probably won't see them again. Now, our job, it's always been pushed to let's save people, let's save people. Everyone wants to go in to save people, and I've changed my mindset from the our job is to save people is our job is to help people. Um, can we help everybody? No. We just want to do our best to our best ability, help this person be in a better place than when we found them. Can we always do things to get people into that place? No. I mean, if the person is already deceased by the time we got there and they're already so far gone that all we can do is, say like that this is it for them. Well, that person lived their life in most cases. And then I'd say having that mindset and having a support network, having people that you work with that you feel comfortable with talking to, joking with. Um, there's a lot of dark humor in EMS and pretty much all the medical profession. I'm pretty sure anyone else that is talking on here or in the medical profession knows that the humor is questionable in most circles, but we have it there. It gets us through a lot. Um, and understanding that as long as we show up and try our best, that's the best we can do. Um, the example you used was a shooting. And yeah, we went there and it's a hectic scene, but stepping back and being like, I don't know this person, right? I'm here to help this person, but I don't know who this is. Um, I'm just here to help this person. It's the same as anyone going, you call um for someone to come and fix something for you in your house, or you call to have this done or that done. It's the same concept. Like you don't know that person when they show up as much as they don't know who you are. They're there to do a job. We're there to help you in whatever it may be. All right, let's step back to our training. What do we do? And we go through the steps with that. Let's get the person in the truck. Let's get them to the hospital. We got her to the hospital. She ended up going into surgery and she's expected to make a full recovery now. But as long as we got them there, we did as much as we could on the scene. We got them in the truck and got them to the hospital. That's all we can do. So there's no need to sit and just think about it. Because it's like, yeah, that's crazy that that happens, and it's. I'd say I was more concerned about the aspects surrounding the situation than the situation itself, how the situation occurred. Because it's like that's just wrong for someone to do that to somebody than the condition that the patient was in. Because I did what I could do for that person. Um, but if you go into the job with the mindset of I have to save everybody, and then you don't save someone, you're going to spiral down a path. And that's when you end up with people who are getting into drugs, alcohol, and eventually end up taking their own lives because they don't step back and realize I didn't cause this person to get into this situation. Right? We are not gods among men working the EMS. We only can do what we can do, and we can't stop people from dying. If it's their time to die, then that's that. Um, we just can attempt to um, get them into a better place. Attempt to, if it's just making them more comfortable, if it's just giving them the decency after they have died, those are things we can do. If it's transporting them, attempting CPR, um, and then decompressing afterwards would be joking about things or talking about things or seeing what goes on. But a lot of times the people that we go to um, who are in cardiac arrest who have died, those are going to be people in their 70s, their 80s, their 90s. And yes, there's younger people that go, and those are other situations. But people who are over, 65, at that point, it's like you have to just remember that this person has been here for 65, 70, 80, 90 years. They've lived their life. They've done everything that they could have done. Um, and accepting that we can't change anything now is a big thing. Um, of course, um, having your support network, growing friends in EMS, joking with those friends is a big thing. But also not getting so caught up in the job that you don't take time for yourself. You don't take time. You don't have activities that you like to do. Um, it's important for people to do that. Um, but I'd say the call, making it so that the calls that stick with you are the gratifying calls, the calls where you actually have made a change, the actual ones that you laugh and you joke. I mean, I always talk about it, how people, the elderly, they fall a lot. We have a joke where it's they fall and they call, because as we get older, we lose our balance a lot easier and we fall, and then it's a lot more dangerous. But going to that call, and if I go there and there's a video that I play in the orientations, it's this clip from Night Watch of this person that fell, and they go there and they joking with him. He's fine. He fell. He's like, I fell and I took a hit, or I could have gotten myself up, but my he's a elderly gentleman. He was celebrating 40-year marriage with his wife that Friday coming up. So the family was joking with him, and it's like, this person's fine. He has a good support network. I'm joking with them. I'm building rapport. I'm smiling and laughing about this, even though that we're in this person's house because of a negative thing, we're now making it positive. Those are the calls. Or sitting with people when they need someone and you're there to support them. I went to this person twice. Um, and it was a while ago now. It was last year. Where the first time we went to her, she fell. She was outside trying to get her newspaper and she tripped and fell. She was in her late 80s, early 90s, can't remember exactly. And we, helped her up. We went in, we made sure that her daughter was coming, or her son, I can't remember which one it was. But then we talked to her and she told us that she would move down to Florida and came back up here because her husband was getting sick and he needed medical care. And we talked to her about that. And then once she was comfortable, we left. And we went back to her, it was a couple of months later, and she had fallen into the newspaper again. Someone really should have brought her newspaper up to her door because a paper person just threw it into the bushes. But we went there and we asked her about her husband, and she said that he had passed away, and she started crying about it and being there just to support her because they had been married for 60 years. 60, yeah, 60 something years. And it's like, well, that's someone that you're used to having there for all that time, and now they aren't there, and now you're just in your house alone, um, a house that you've lived with this person with for all this time, um, just being there to support her, in her time where she just needs someone to comfort her. Those types of calls when you're actually there just to um, make sure someone, and being there until the neighbor came and sat with her until her children came, are all the calls that give you that gratification. Or this person that I went to where her apartment, it was an elderly apartment, um, independent living apartment, was flooded, so they moved them into hotels, and no one told her how to get food or water or anything to drink, and just being there to give her access to food, getting her room service up and making sure that the city was paying for it or the town was paying for it, making sure she had water to take her medications, where it's like, yeah, this is something that is outside of what is expected of an EMT or of a paramedic or anyone responding on an ambulance. But we're helping these people. We're getting them in a better place. Using those calls, using the positive calls, that's the ones that you think of when you do the job. Those are the ones that will keep you doing the job, not focusing on the negative ones where the outcome is not necessarily what you don't want it to be, but focusing on the ones where by me being there, I've helped this person is the one that people have to focus on.
In closing, I want to reflect on the fact that you've saved my life. I don't know if you remember, you were an early EMT and I was choking on a carrot. Speck of
Happened twice. Happened twice.
yeah, it did happen twice, but you saved my
Baby
life.
carrots.
Yes, and I don't eat carrots unless they're pureed now or in a soup form because I cannot swallow carrots. A speck of carrot will cause me to choke. So what you've learned has kept me here, but more importantly, we're coming up on the angelversary of your great grandmother, my grandmother. And I can say that when we brought Nana home for that 3-week period, you jumped into action and taught us how to do the feeding tube, how to use the stethoscope to listen, how to, roll her without continuing to sprain my shoulder. Um, this work works. Everybody needs someone like you in their home to, you know, do the blood pressure checks, to do the administering of fluids because your mother is always dehydrated. The training has benefited more than a career for you, and I am ever so grateful because when you were born, I was not, I didn't think long term. I don't think any parents think long term, and I know you're squirming now. I see it.
Oh no, I was looking for my water. I don't want to get upset.
But long term, think about the fact that you're caring for strangers. I already said I'm not living with your sisters when I can no longer care for myself. I'm going to live on your property. I don't have to live directly in your home. On your property, and you're going to get people to care for me. And I'm convinced of that because of the care that you give others. So I want to thank you for the work that you do. I know people say it all the time. Thank you for your service. If they don't, they should. And I'm proud of you. I'm very proud of you. I was a little skeptical, as you know, in the beginning when you told me you were taking an entire semester to become an EMT, but I see it. I see you. And I can't wait to see who you continue to evolve into. With that said, thank you for your service. Thank you for tolerating me for 24, almost 25 years, and
Thank
continue to
you.
grow and finish that last class so you can get your bachelor's in biology. Thank you for joining the Healing Through Our Heritage program. And if you, this is a question that my partner in crime, Sandra, would ask you. In closing, can you've given us several skills, but can you tell us three things, three black jobs, that three black skills that you would recommend those who listen to this seek out? Now, you've already mentioned that everyone should know basic, what is that? Basic life saving,
A
CPR.
basic, so CPR.
Yeah.
Everyone should know CPR, of course.
Okay.
Everyone should know at least hands-only CPR. Um, everyone should know stop the bleed. And a third one. Um, that's a tough one.
Dum 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 dum.
I can't think of a third one. Another job, another thing that someone should have.
Well, you already told us that. I mean, everyone's preaching Narcan, but you already told us that it's not effective when in the
Well,
case.
everyone needs to have Narcan still when someone's having an opiate overdose. But so I thought about that as I said it. That everyone should still have the Narcan. That I'm not saying don't that it's not effective. for opiates. I'm just saying things are being added to it that cause it to be less effective. There's a bunch of synthetic drugs being added into it that are affecting people. So still get your Narcan, and if you know someone is using opiates, that's the first line drug of defense. Um, but that would go into that, know how to use an Narcan, know how to do the CPR, know how to stop bleeding, um, know basic first aid skills. There is courses done by multiple agencies. Red Cross and the American Heart Association run two different courses of. I know that the AHA's one is named Heart Saver First Aid CPR. It will teach you, excuse me, all the things I've been talking about. So it teach you CPR, hands-only CPR. It will teach you relief of choking. That's another thing that people should know. There's a fourth one. You should know how to do the abdominal thrust now. I can't use the other name that everyone knows it by, Heimlich maneuver, because of the grandchild wanting money from it. Um, the it will teach you first aid skills, so that stopping bleeding, EpiPen uses, Narcan uses, splinting, affected extremities, especially if you're going to be out and about. Um, and I'd say it also teaches you how to call 911 properly and handle talking on the phone when a high stress situation, which is important.
Well, thank you. And thank you for your black job. With that,
Yeah.
we are complete. Tune in on another day with our next guest.